Hey everyone, I am happy to welcome each and every one of you to today's webinar, where we will be discussing 12 telehealth and digital patient engagement KPIs every health tech leader must have. My name is Brooke. I am a junior marketing coordinator here at Mend. Today I have the privilege of joining Matt McBride, CEO at Mend. Matt, how are you doing today?
I'm doing great, Brooke. Excited to be here. I know we've got a massive audience, so looking forward to it.
Awesome. First, we are going to go through the agenda, which is packed with great stuff today. We will first start out defining what is patient engagement. Then we will cover 4 groupings of KPIs that are vital for healthcare technology, which are as listed: telehealth, digital forms, patient self-scheduling, and patient engagement. Finally, we'll round out today's webinar with a Q&A session. Starting now, you can use that fancy Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end. Okay, let's dive into today's webinar now. Digital patient engagement can happen before, during, or after a visit. Matt, can you take us through the different touch points?
Yeah, absolutely. So just kind of using Mend as an example, I think, patient engagement could really be any sort of communication back and forth with a patient. I mean, it could be, while they're in the location, or maybe they're in their home, maybe it's before the visit, during, after. And so it can encompass a lot of different areas. So it might be self-scheduling, reminders, telehealth, forms, payments, check-in, could be maybe bulk communications out to patients, to maybe looking to get reviews, surveys, or maybe a final payment after a visit. And so I think there are a lot of exciting things going on with patient engagement and patient engagement platforms. And I think it's also something that we'll get into that patients are really looking for as they seek out care.
Patient engagement can touch every aspect of healthcare organizations' journey with a patient, which therefore we are going to have all the stakeholders involved. Matt, what are the benefits to the stakeholders?
Yeah, I think it really is a win for all that are involved. So first, with patients, I think being able to use digital tools, ways to communicate digitally that are easy, convenient. It allows people to get engaged in their care. And I think that ultimately leads to things that clinicians are looking for to, improve outcomes, keep patients compliant in their care, and just have a better, overall continuity of care, which then I think leads into the C-suite, where I think a lot of patient engagement tools result in lower no-show rates. So we're talking about maybe increasing revenue, meeting quality measures, making things more efficient, maybe less manual for staff. So really there is a win for everybody. And it's going to be an important part of the future of how healthcare is delivered.
Accenture surveys patients every year to understand what consumers are looking for from their healthcare provider. Matt, I know you looked at the last 2 years of research from Accenture. Can you take the audience through some of those key findings?
Yeah, I mean, I think it's pretty consistent. Accenture, there's all kinds of other organizations, associations, or other, groups like Accenture that go out and survey patients to kind of see what they want, what are the trends in that industry, and healthcare is a big industry. And I think it's pretty consistent that, we see very similar data. So this is just one example, but 69% of patients, they want to be able to communicate through secure email with their providers. 70% want reminders via email or text. 54% want their doctor to deliver their care and not just some random doctor, somebody that knows them, has their information and that they have a relationship with. 68% want to be able to book, change, or cancel their appointment online. And then, 52% and I think this number can vary for virtual appointments, but I think the point of this one is that patients are really open to virtual care across any type of appointment, whether it's something routine or, diagnosis of an illness, something chronic, specialty, et cetera. So I think that, this is really something that consumers and patients are looking for as they, choose their doctor, their healthcare organization. So definitely something to pay attention to.
The pandemic brought digital engagement to the forefront of healthcare, and numerous studies and articles have come out recently talking about how health leaders are looking for platforms instead of point-based solutions. Matt, how does Mend fit into the digital patient engagement landscape?
Yeah, so Mend is actually a full patient engagement platform. So I think that's going to, help set the stage for not only the KPIs we're going to take everybody through, but then we're going to share all of our data, across all of our visits to kind of give you a benchmark and what can these numbers look like, or what do they look like on average across all these different organizations. So Mend doesn't just offer patient engagement solutions for virtual appointments. We have basically a comprehensive platform for virtual, in-person, really any type of visit type, a phone appointment type, or a provider going somewhere. And so as we go through and we share these KPIs, and then we're going to share a lot of our data. I mean, we've conducted, millions, we touch millions of appointments every year. We send millions of forms. In our history, we have actually closer to 4.6 million patients. So, and almost every state all over the United States. So every age, every, demographic really you can think of. So I think a lot of the data that we're going to share today will serve as a good benchmark for everybody to use. And, as you're developing a patient engagement or digital front door strategy, or whether you're trying to optimize your current strategy.
Let's go ahead and switch gears and get right into the first group of KPIs, telehealth. Matt, would you mind taking us through it?
Yeah, absolutely. So telehealth is obviously, because of the pandemic, there's been a big shift, and a lot of people have been patients with telehealth, providers, or maybe even both. So our first KPI is telehealth no-show rate. And, tracking that separately from in-person no-show rates. So you may want to look at a blended average too across all the appointments. But where we're going with this is that, we see about a 23% average no-show rate in the United States. However, with telehealth, we see consistent single-digit no-show rates from customers that report them back to us. So there's a big opportunity to help more people with telehealth, maybe to direct appointment types that have high no-show rates to telehealth. And I think a good benchmark for a telehealth no-show rate should be somewhere in the single digits.
I know I have personally experienced a wait time when seeing my own doctor, which I am sure everyone joining us today can agree on that. How does wait time translate to telemedicine visits?
Yeah. So again, I think, this is something that can be tracked very well when the visit is entirely virtual and can almost be tracked down to the second, really. So some organizations may track this for in-person visits, but for telehealth, this can definitely be tracked. There isn't necessarily a concrete study or analysis of a meta-analysis of a bunch of studies around telehealth wait times, but there are some sources out there that have published sort of a generic telehealth wait time in the ballpark of 15 to 20 minutes. So that seems to be, the industry average. More specifically, within MEND, we see on average about a 13.5 minute wait time. And we can provide this data, at the provider level, at the org level, so on and so forth. And we'll get a little bit more into the wait time and why it's valuable. But there's a lot of time being spent waiting. Now, the patient didn't have to travel, so you save them that time, so that's good. But if you look at some of this additional data that we included in 2021, we had almost 19 years of time spent waiting to see a provider. So I think it's a lot of time to do something productive with that we'll get into a little bit, but definitely a key KPI to track around any telehealth program.
Matt, so far you have referenced that many organizations on MEND have single-digit no-show rate, and the average patient wait time is roughly 13.5 minutes. For quick reference, can you explain the MEND telehealth software?
Yeah, so we'll keep the demos to a minimum, but we at least wanted to provide some context for where our data is originating from. So telehealth, for example, on MEND, the patient will receive a link and via text and email. They click the link, put in the date of birth, and then that's it. They're connected. They're connected whether they're on a mobile device, tablet, desktop. Everything's 100% HIPAA compliant. So it's really easy. There's no logins. There's no software to download or anything like that. So that's part of why we can achieve some of the results that we do, is that we just keep it incredibly easy for folks to connect. So we want to just give you some context of what that looks like, so you kind of get some idea of where the data is coming from.
Patient satisfaction is extremely important for patient experience and loyalty. At MEND, what have we been able to measure around patient satisfaction?
Yeah, and so I think in terms of satisfaction, there in some cases the government requires it across any type of appointment. So I'm sure a lot of organizations are tracking some form of satisfaction. But specific to telehealth and in breaking that out, I think there's a theme here of looking at in-person KPIs, virtual, and then maybe some blended rate. But nationally, satisfaction rates for telehealth can be a little low in our opinion. The Healthcare Coalition, which was studying a number of different factors related to telehealth during the pandemic, non-paid, lots of different organizations communicating their stats. It's 77.6%. I mean, that's a C plus. I mean, it's not bad, but it could be better. The National Library of Medicine studied it as well at 83% satisfaction. And what we see is actually a 5-star patient satisfaction rating pretty consistently especially when we take advantage of that wait time. When we take advantage of that 13 and a half minutes and we are able to deliver value to the patient, if they do experience a wait time, we see patient satisfaction closer to 93, 94%. So definitely important, an important KPI to track, and is a baseline, getting into a patient satisfaction rating for telehealth that's in the 90th percentile is definitely possible.
Matt, the enhanced virtual waiting room experience is extremely unique to Mend and certainly one of a kind and rather different for our audience today. Can you explain this innovative waiting experience that Mend has created?
Yeah, so what we've done is just, looking at this data and seeing that there's an opportunity here. I think on a lot of platforms, you're maybe looking at a blank screen or maybe just a static page. There's not a lot going on if you have to wait. So, I mean, if you can just imagine yourself, sort of staring at a blank screen for, 13 and a half minutes, not the best experience. So what we've done is we've created what we call an enhanced virtual waiting room experience, where we've put a library of educational content into the waiting room experience. So there's TED Talks, there's, maybe you want to learn about heart health, how to meditate, there's specialty specific content. We can upload custom content. It gives the patient some entertainment while they're waiting. I think the other thing that it does, and why we see such a boost in patient satisfaction when we just turn this on or off, is that I think this presents an experience that says, this healthcare organization cares about me. They care about my health. They care about my well-being. They're maybe helping me to learn something that could benefit my health in the long run. So what's really interesting here is that, if we turn this experience off, we see satisfaction rates that compare to, the Healthcare Coalition and what we showed in the slide before. If we turn this experience on, it jumps into the 90s for patients. So there's definitely an opportunity to leverage that wait time and do something productive with it that, will ultimately lead to patient satisfaction, which can lead to better reviews, loyalty, so on and so forth. So that wait time is really important, and what you do while that person is waiting can have a big impact on patient satisfaction for your telehealth program.
Matt, I want to make a note for our audience that we are not actually conducting the visits. Mend provides the telemedicine software platform, but the goal for each appointment slot is a successful visit in which a patient is helped. With that being said, I can definitely see why this is an important KPI to track. How does Mend go about looking at this data when we are not the physicians and billers providing those services?
Yeah, so I think completion rates are definitely a key KPI, and it's something that customers ask us for. But as Brooke said, we don't have a lot of context for what's happening in the visit, right? We're not listening in to what the patient and the providers are saying to know, did the visit really happen, and is it charted, coded, submitted for billing? What we do know, though, is in a lot of cases, we do get reports if the appointment was checked out, no-showed, canceled, etc. So we can look at a checkout and sort of assume that is a successful visit. We can also look at participation in the visit to see how long folks were connected. So if we sort of look at those two different methods of comparing success, we see a pretty high percentage of successful visits completed on Mend, which I think also aligns with, the low no-show rates, the single-digit no-show rates. So I think this is definitely something that you want to track. What do the completion rates look like for telehealth over in person? However, to really get an accurate number, if you want to have this number accurate down to the number of appointments, it may require some reporting from the practice management system, maybe a business intelligence system that can tie all the data together. Because as a telehealth vendor, and like other telehealth vendors, we just don't have any context of the visit. So essentially, we've created some baselines, and those baselines we can measure consistently, and we can see trends, but it may not be accurate down to the exact visit, and may require some reporting from the practice management system.
Connection quality and the ability to function on low bandwidth is important to be able to help more people. What does the connection quality data tell us at Ment?
Yeah, so connectivity is always a top priority in telehealth for every customer. And while we do have pretty good bandwidth in the United States, it's not 100%. There aren't 100% of people that have access to high-speed internet. I think, everybody's maybe experienced that during the pandemic already, so we don't have to go too deep into that. But you want to be able to look at the data, on a user level, look at the data maybe across providers versus patients, look at the data as a whole to see what does that connection quality look like. And so at Mend, we provide that level of reporting. It's really important on the staff and provider side to look at connection quality, because some providers are remote now, or maybe one location, they're having some trouble with their equipment that really is unknown. And so you can really drill down into specific users to look at their connection quality. And we work with customers to proactively identify people who might need to improve their connection quality. You can even look down at the patient level to maybe identify patients who have poor connectivity. Maybe it would be better if they came in and sat in front of a kiosk and the provider was still remote, but maybe, they need a little bit more assistance with the technology, or maybe they just don't have access to great internet connectivity. So definitely a key KPI to track for any telehealth program. What we typically see is, 98% strong internet quality, from orgs that are, proactive and follow best practices. And then other orgs, on sort of average, what does the average look like? About 92% of visits have good internet quality. That doesn't mean 8% are going to fail. It means that 8%, maybe it's not quite high def. Maybe it's it's not great internet. There could be some hiccups in the visit. Doesn't necessarily mean that it will fail. So definitely something that can be monitored as a KPI. And there are definitely ways to message and educate folks and improve the connection quality as a whole for your telehealth program.
Matt, with connection quality being such a hot topic for anyone conducting telemedicine visits, let's go ahead and poll our audience. We have 2 questions for everyone today to answer. The first one is, what kind of telehealth solution do you currently have in place? I will go ahead and give everyone a few seconds to answer this.
And everyone, I think, should see a pop-up come up on your Zoom and you can plug in your answers.
Okay, and then I have one more question for everyone. Our second question here is, what's the connection quality of your telehealth platform? 1 being the worst, 5 being the best. I'll give everyone a few additional seconds to answer. And I will note that towards the end of our webinar, we will share the results to these polls as well. Okay. Thank you everyone for participating. Providers are an important piece of a successful telehealth program. How should a healthcare organization measure provider utilization?
It helps if you're off mute.
Yeah.
This is the last KPI for telehealth. And this really comes down to a workflow or maybe how your organization utilizes telehealth. So maybe, there's more of an enterprise license in play, want all the providers to have access to it, but depending on the specialty, maybe, a lot of the providers maybe just would occasionally use it, or maybe if there's a, spike in COVID or something like that. So could just be a tool that you want everybody to have access to. Or you could be, a behavioral health organization and doing almost all of your visits through telehealth. And so then provider adoption could be something very important to you that you would want to measure and keep track of. So this could be a good KPI to track, just depending on, how your organization leverages this specific type of tool. We do see, really strong provider retention rates at around the 20 visit mark. So, providers are busy. They don't always have a lot of time to invest in training and whatnot. So, it could take several visits for everybody to get used to a new platform. But we do see around the 20 visit mark that provider retention is very strong.
Telemedicine was critical to care during the pandemic, so I hope our audience found the KPIs and data insightful. Let's pivot to patient intake and forms. Matt, can you share with us how our audience should measure digital forms?
Yeah, absolutely. So there's a lot of advantages of digital forms that we'll talk about, but the first KPI would be completion speed. So, how fast is that information coming back to you when you send out those forms? We'll, in a couple slides, show you what it looks like and how we achieve these results. But over the last million forms on Mend, 68% came back in an hour, 75% came back within a day. So I think there's a lot of advantages to this and getting folks engaged in their care, but measuring completion speed could be a key KPI for any digital form solution.
Matt, digital forms seem to get filled out very fast. What is the overall completion percentage for Mend digital forms?
Yeah, so, for this KPI, the actual completion rate of your digital forms can be important, especially if you're trying to automate, not having staff deal with these manually, put them on clipboards, transcribe them into the system. Getting a lot of the forms completed digitally, can really save on a lot of manpower. So that completion rate can be very important, especially if you invested in a tool. So across all of Mend, we see an 86% completion rate So again, we make it really easy. And I think that where digital forms are ultimately moving towards is that they're sort of becoming the new appointment confirmation. You get a form, you get your forms out to folks, and they can be sent out automatically from Mend with an integration. Most of them are being completed within an hour. That person has started to invest time in that appointment. And our customers consistently say that, when somebody completes their forms, they attend the appointment. So, this isn't, PDFs on a website. If you engage with folks digitally and with forms that are easy, I think you can almost look at this as a new appointment confirmation, and you start to get people engaged and invested in their care before the date of the appointment.
That is awesome. That means almost 70% of forms come back completed within an hour. Give the audience more context, can we see a quick demo of Mend's digital forms?
Yeah, absolutely. So again, just, since we're sharing some data, here's real quick what it looks like. Essentially, they get a text or an email with a link. They click the link, put in their date of birth, and we can take all the paper forms and make them digital. We can get photos if we need photos of insurance, driver's license, maybe a wound, maybe some sort of skin issue, getting a photo of an income verification form of, a W-2 or a pay stub or something like that. So there's a lot of use cases there. We can get complete histories, the pharmacy, allergies, medications. It's e-sign compliant, so we can get any sort of agreements captured. You can have multiple people participating in a single form for treatment plans between maybe providers and patients. We do a lot of clinical assessments as well, especially in behavioral health or other specialties. So there's a lot of versatility here to reach out to folks, get the information and data that you need to, have a successful visit and have all the information needed to bill insurance as well. So, I think a key touch point in patient engagement here.
In the Accenture data we covered earlier, 68% of patients want to book, change, or cancel appointments online. Patient self-scheduling is gaining in popularity. How should we track patient self-scheduling?
Yeah, so I think the first KPI here is adoption. How many appointments are moving to self-scheduled appointments? And there's a couple different ways to approach this. Maybe you want to start with reschedules and cancellations. Maybe you want to allow certain appointments to be self-scheduled, messaging visits to be self-scheduled, or maybe you want all of the appointments to be self-scheduled. We can accommodate any of those cases, but you definitely want to start to track adoption. How many appointments are we moving out of a call center and into, somebody just doing it automatically and having it synced up and integrated to the master schedule? Also, another reason why this KPI is important is patients have been conditioned to call for everything that they need. Call to book an appointment, call to make a change. Everything's been done over the phone. So there is going to need to be some sort of education effort, and adoption might, be slow and just sort of ramp over time. So as we look at customers that allow for self-scheduling, we see about a third of those appointments moved to self-scheduled appointments. So no phone calls, nobody had to, spend their time, booking the appointment and doing it, sort of the manual way over the phone. A third have shifted to being done automatically, and that number continues to rise. Of those, about 16% were cancels and reschedules. And then I think there's a big opportunity here for organizations, because across all, our entire platform, only about 13% of appointments are self-scheduled. So not a lot of folks kind of believe in self-scheduling yet, or they think that maybe the schedule is too complicated. We've dealt with all the complicated types of situations. You can offer self-scheduling. And I think this can be, a great way to just, great convenience for patients, and, allow you to accept business, 24/7, 365. Some other interesting data here. We do see a low no-show rate for patient self-scheduled appointments, about 5%. But again, definitely an opportunity here for more people to think about patient self-scheduling and offering that to your patients.
It's really exciting to see more and more healthcare organizations offering patient self-scheduling. If a patient changes an appointment, what are the most common reasons for the change and why?
Yeah, so again, this might be something that you track today through the master scheduling system. If somebody calls to make a change, maybe you track the reason. We can also do this digitally, right? And we can make it convenient for people to make changes. And you can see what the majority of the reasons are why people need to make a change. There's some sort of conflict or some sort of personal reason. Most of the other scenarios are pretty low on a percentage basis, right? So I think if your organization is looking at, a no-show rate that's, 20% or higher, think about why people are making changes. Again, they're canceling and rescheduling here because of a conflict and a personal or a personal reason. If it is not easy for them to tell you that they have a conflict or some other reason why they can't attend, now this is where the no-shows are coming from. Maybe they called on their lunch break, they called after work, they weren't able to talk to somebody, maybe they didn't even try to make an attempt to call at all. So giving these digital tools allows people to tell you that they're not going to be able to make it. And then that just frees up that slot for somebody else that actually needs care. So, so think about, maybe you don't want to offer full patient self-scheduling for new appointments or established patients, but you can definitely start with just cancels and reschedules. It really starts to make a dent in no-shows.
I know Mend offers advanced patient self-scheduling that spans any type of visit. Matt, can you explain our patient self-scheduling solution so our audience knows where our data came from?
Yeah, absolutely. So again, just wanted to give you a little bit more context here. Essentially, we offer an online booking experience. We understand all of the things that need to align, right? Might be the type of insurance somebody has, and if that provider accepts that kind of insurance, the provider's availability in open slots, maybe locations in, finding a convenient location for somebody and, aligning that with the provider availability, specialty. Maybe providers have certain ages that they see or don't see. So we understand that all of these different things need to align into a patient self-scheduling experience, and we can synchronize all of that information with the master schedule, and then provide an easy, automated way to be able to allow for the booking of new appointments, or allow patients to easily make a change by just clicking a link, putting in their date of birth. They can make a change, or they can go to your website to book a new appointment.
Having measurables for specific engagements is important, but some KPIs will span an entire digital health strategy. Matt, what is important to track regardless of the specific solution when patient engagement software is being implemented?
Yeah, so I think the first KPI here, no matter what you're doing with patient engagement, it's typically going to involve going out and communicating with somebody through text and email. So you've got to be able to understand the health of the contact information that you're using. So this is something we measure and can help measure with customers. And this has definitely improved over the years. So we see on average about 98% of patients have valid contact information. That still means there's 2% that are unreachable, right? So 2% could mean a lot of revenue depending on the size of your organization. So I think it becomes really important in the digital age to make sure you always have the correct phone number, you always have the correct email address on file so that you can reach out to somebody with a digital form, with a text appointment reminder, with a link to connect to telehealth, make a payment, whatever it is that those solutions are doing. So then just some other interesting information here across the platform. We get phone numbers from customers. They're not usually tagged as home, phone, or mobile or office or anything like that. But we see 96% of our numbers are indeed mobile numbers. So landlines are definitely becoming a thing of the past. And so I think you could expect something similar across all of the phone numbers that you have in your system. And then we're being provided email addresses, valid email addresses 75% of the time. So this is definitely an area that can be improved. And we definitely understand not everybody has an email address, or they, maybe a couple share email addresses. We've encountered and dealt with all those scenarios, but definitely an opportunity for redundancy to improve results, improve attendance to appointments, improve the speed at which you get information done and completed in digital forms. So again, this is a key KPI to track.
With any technology, we know it doesn't always work 100% of the time. Matt, how should organizations track support-related issues, if any were to arise?
Yeah, so again, I think any technology that's being used, being able to have support around that. And at Mend, we provide support to patients, providers, and staff. And then being able to have some sort of categorization of those tickets that come in. So actually, there's a little mistake in the slide. I put the period back in, but it's not showing. It's only 0.8% of visits need tech support, need some sort of technical support, and we assist the patients with that, or providers with that, so they can do what they need to do, complete forms, et cetera. But then there's a lot of, sometimes we get other questions. Maybe if they're waiting, they might be asking about medication refills, or have some other, question related to their care. So really understanding the types of questions that are coming across and having access to that through your support channels is going to be key for any technology that is consumer facing or patient facing.
Matt, we've covered a number of key measurables and shared a lot of Mend's data for each. So thank you for that. I know you don't let anyone write these materials for you, and you have written something additional for the audience today. What do you have for everyone? Please share.
Yeah, so everybody, the first question we always get, and the first question today was, are we going to share the slides? So yes, we will share the slides. We have the presentation recorded as well, so it'd be available on demand. But then we also have an ebook that I've written that provides all of this data and then gives you all of the context that we've been discussing throughout the presentation. So we'll make sure that everybody gets a copy of the ebook as well. So slides on demand in the ebook, we'll make sure that everybody gets those after the webinar.
Ladies and gentlemen, we've completed the 12 KPIs portion of the webinar. Hopefully you found the KPIs and data we shared today valuable. Matt, can you briefly describe the MEND platform?
Yeah, absolutely. And again, I think what MEND has built is a comprehensive patient engagement platform, right? So I think a lot of groups are looking to consolidate point-based solutions. I think it's more expensive to buy things individually, integrate them individually, maintain those interfaces individually, and then it might not ultimately deliver the best final experience to the customer or the patient. So, really with, one partner in MEND, one integration, we can provide one experience across all the different touch points that we showed at the beginning of the presentation. So whether it's reminders, payments, scheduling, AI, telemedicine, forms, messaging, other tools like we offer, bulk notifications, secure messaging. So we can really be a single platform for an entire patient engagement strategy.
If you are looking for more informative content, we keep a library in the resource section of the men.com website. In February, Matt authored a webinar and ebook titled 19 Massive Telehealth Learnings After 4 Million Visits in 2021. There are a ton of great learnings from working closely with all of our customers over the years, and we wanted to share as many tips, tricks, and best practices so you can help as many people as possible. Simply navigate to men.com, click on resources, and you can access all of our on-demand content. As we start to wrap up our webinar here, I wanted to briefly switch back to the results from the 2 poll questions that we had. So for the first question, it was, what kind of telehealth solution do you currently have in place? It looks like most of you, 45%, answered video conferencing, whether that was Zoom, Google Meets, Teams, etc. And a little less than half of you said enterprise and HIPAA compliant solution. And our other question was, what's the connection quality of your telehealth platform? It looks like 48% answered 4 to being the best, and only 5% answered to being the worst. Today's webinar has been amazing, but before we jump into the Q&A portion, we want the audience to know it's easy to schedule a personalized demo of the MEND platform. Just go to men.com/demo. And with that, Matt, let's go ahead and jump into the questions. As a reminder to our audience, Zoom has the Q&A option in the toolbar, which will make it easier for us to answer your questions. Our first question for you today, Matt, does MEND track all of these KPIs for customers to review their own data?
So yes, we have account managers, and they are able to provide all of the data at an org level, pretty much for all of the KPIs that we discussed today. So we do measure all those, globally. We can provide them to customers. We do also provide reporting within the portal itself. So some of the data is also available at a more granular level to get into maybe specific connection quality, or get into specific wait times around, from provider to provider. So there's different ways to look at some of the data, but ultimately, yes, we can provide customers with all of this data so they don't have to track it on their own. And we do typically provide the Mend community data as well. So you can always get a feel for how you stack up. And we usually have the data week over week. So that could be rolled up into, a month, a quarter, a year, however, so you can really understand how you're performing and if there's areas that can be optimized or maybe areas where you're really excelling.
Another question for you here, Matt. I'll let you briefly go into this since you've been here the longest. How long has Men been in business?
Yeah, so we founded the company in 2014. So it was about summertime 2014. So we've been helping organizations of all different shapes and sizes across 89 different specialties in almost every state within the United States. We do millions of visits, millions of forms. We've helped about 4.5 million patients to date. So there's not a lot that we haven't seen. So I think we can be a great partner and really help to navigate and set up a successful patient engagement program.
Another question here for you. Do you sync with iPhone apps and other home monitoring devices?
Yeah, so good question. So sort of a, remote patient monitoring question. We are going to be putting out materials in probably the May, June timeframe that are going to hit on this specific point. But what I will say is the way things are trending, we will be able, by the end of the year, we will be able to offer solutions that capture vitals through any web camera. Web cameras are ubiquitous. If you have a device and you're doing, any sort of digital patient engagement, you probably have multiple cameras on that device. We can get pulse, blood pressure, heart rate variability, stress index. You would be shocked at the amount of data using artificial intelligence that we will be able to get through a web camera. So that's where I think things are headed, and they're headed there quickly. And then people don't have to mess with apps. They don't have to mess with devices. They don't have to, deal with a lot of that. Before their visit, they could simply look at a camera for 30 or 60 seconds. We can capture the vitals and then pass that data along to the provider.
Yeah, awesome. And a question following that up, a little bit similar to it. Do you have two-way messaging?
Yes. So we do have a two-way secure messaging. And I think what's cool about how we've set that up is you can use it for ad hoc communications. So if maybe you need to get a doctor's note to somebody, or you have a question or what have you. But I think what a lot of groups should be looking at is a secure messaging visit. You can have patients self-schedule this. There may not be strong insurance reimbursement, but I think a flat fee around the cost of a copay payment, I think, is very tolerable to patients. And I think a lot of the things, maybe prescription refills or maybe just basic issues, I think a lot of those things could be directed to messaging visits, which are two-way. We do allow users, specifically staff and providers, to end those conversations as well, so there can be a conclusion to that conversation or a conclusion to that encounter, so it's not open-ended messaging at any time. So yes, we do have two-way that can be used in more of an ad hoc fashion, can even be used across groups. We also have a two-way HIPAA compliant, secure messaging visits that I think could be a great opportunity for organizations to maximize productivity, but also, offer a convenient way for, patients to get care that when maybe they don't need a full appointment.
The enhanced virtual waiting room looked interesting. Can I upload videos about my organization?
Yes, we do allow organizations to upload custom content. I will say, we get that question a lot. Not a lot of organizations take advantage of that. And again, we showed there was 19 years spent waiting just on Mend in 2021. This is a great time to tell people about your story, right? Maybe how the organization came about, things you're doing in the community, other services that could be valuable to know about. So taking advantage of this time is, can definitely benefit the organization, but I think as we showed too, you're also going to get a bump in patient satisfaction as well. So yes, we do allow organizations to add their own video content to that enhanced virtual waiting room experience.
Is your patient self-scheduling feature for telemedicine appointments or in-person appointments?
Yeah, so a great question. And everything that we offer is meant to span any type of appointment. So our patient self-scheduling, that could span virtual visits, in-person visits. We have organizations that have phone visits, that offer messaging visits, that have encounters where the providers go to meet somebody at a school, their home, et cetera. So any appointment type, doesn't matter the complexity or anything like that. Our patient self-scheduling can work across any appointment type. So, if you are really adopting the hybrid care model and wanting to give patients messaging visits, access to telehealth, et cetera, but you still have in-person as well, what we do is we work to develop a triage. And so before they secure that appointment, we ask them a few questions to route them to the right appointment, provider, location, availability, et cetera. And so we essentially have a very simple, easy to use triage. And then we can route that person to a new patient visit, a follow-up, telehealth, in person, what have you. Everything that we built is really meant to work across any appointment type, whether in person or virtual.
Yeah, awesome. As we are running close to end time here, Matt, did you see any more key questions that you felt you wanted to answer at this time?
Yeah, there was one about will insurance coverage continue for telehealth after the pandemic. I think a lot of folks heard in the news the $1.5 trillion package that got approved. That has a 151-day extension for telehealth once the public health emergency ends. So it has already been signed by the president. Telehealth has been expanded beyond the public health emergency. And I think I think everybody anticipates there will be some permanent form moving forward. So, we're very confident that telehealth is going to remain. And then somebody had also asked too if we sync to the EHR systems. We do. We have full bidirectional connectivity. We have over 81 systems that we connect to, and we have an integrator that can also really connect to any sort of system. So we can really integrate the patient engagement touch points and really automate a lot of them, send forms out, they come back completed, move them back in, get all the reminders out for telehealth with the links, there's a lot that we can do that's automated. And so we do have connections with, all the major EHRs, again, over 81 different EHR systems. So with that, Brooke, I think we're at time.
Yeah. Thank you everyone so much for tuning in and joining Matt McBride and myself today. It was an honor discussing this with you, Matt. And we hope everyone will tune in next time.
Thanks, everybody.